Welcome back to the Climate Conversations. I'm your host, Julie Yu. To end the year, we'll be diving back into the archives to highlight some of our favorite episodes. And on this one, you'll hear how one man is taking on a small but rather deadly creature, the mosquito. In this eye-opening conversation, I speak to Scott O'Neill, the visionary founder of the World Mosquito Program. We delve into the intricate issues surrounding the global dengue crisis. You'd also get a glimpse into his pioneering work with Wolbachia-infected mosquitoes, an innovative approach in the fight against dengue.
You're listening to a CNA podcast.
Welcome to the Climate Conversations. I'm Julie Yu. We are all familiar with this tiny creature that spells big trouble, mosquitoes. Aside from being blood-sucking nuisances, their presence may also mean disease and even death in almost half of the world. One of the most dangerous diseases they carry is dengue, a viral infection that can lead to fatal consequences in severe cases. And it doesn't help that climate change is exacerbating the problem, pushing disease-carrying mosquitoes into newer, warmer territories. And in fact, scientists are predicting that mosquito-borne diseases will impact 60% of the world's population by 2080. What other emerging mosquito-borne diseases should we be wary of? And are there ways we can reduce the threat? My guest today is Professor Scott O'Neill, founder and CEO of the World Mosquito Program. Scott, welcome to the Climate Conversations.
Yeah, it's a pleasure to be here.
So first of all, I want to know your story. How did you get involved in the fight against mosquito-borne diseases?
It started a long, long time ago. I've been working for a number of years in the field. When I was a young student, I had a professor who was really interested in mosquitoes and mosquito disease, and he sort of guided me in that direction. And for me, it felt like tropical diseases were an area that there was not a lot of work being done and was a good area to get into as a young researcher because the problems were big and there wasn't a lot of attention being paid to them compared to something like cancer where everybody was working on it, or immunology. So strategically, it seemed as a young researcher a good area to get into. And I got really interested and obsessed about this bacterial agent, Wolbachia, which I've spent my career working on, and how it could be used to control mosquito-transmitted diseases.
Yeah, we'll absolutely talk more about that later in our conversation. But could you share with us some of the interesting insights that we may not know about these tiny but deadly insects?
Well, they're probably our biggest enemy from the point of view of the disease they transmit. Not all mosquitoes carry disease, and even if you've got a raging outbreak of dengue occurring in Singapore, which happens fairly regularly, most of the mosquitoes don't have any disease or any virus or anything in their bodies, but they're able to pick it up from people that are sick and then transfer it to other people. And as a result, they're responsible for probably more human deaths around the world and disease than nearly any other animal that we interact with on the planet. They're our biggest enemy.
Let's talk more about the dengue, which threatens almost 40% of the global population. The cases are now showing up in places that aren't subtropical or tropical. Would you have predicted this would happen 10, 20 years back? What's changed?
What's changed is a number of different things have changed. One is increasing urbanization and the increase in the global human population. And most of those people are living in cities and are highly packed together. And so that's creating a good environment for mosquito-transmitted diseases, because as these cities and urban areas grow, often they're not fully serviced with running water and drainage. And so it makes perfect grounds for mosquito populations to flourish. On top of that, another key factor is travel. It's so easy now to move around the world on an airplane, and so many people do. And so that's carrying both mosquitoes and disease agents inside people from one location to the other. And these particular diseases that I work with, water is very important. With climate change, a lot of people talk about temperature, but what people don't talk so much about is how water gets managed as a result of that. When you have water insecurity, people start storing water. If your piped water coming to your house gets disrupted regularly, or if there's not so much water around, if things get drier, then people start to collect water in buckets so they can water their plants or to do whatever, their laundry or whatever they wish. And that becomes perfect breeding ground for mosquitoes as well. It's a complex mix of all these different factors that are happening in the modern world at the moment that make diseases like dengue more prevalent. They're spreading in their range. We're seeing bigger outbreaks. We're seeing more cases, etc., simultaneously.
So, Scott, let's talk about the hope for controlling the spread of dengue and other mosquito-borne diseases. Now, one promising approach involves your groundbreaking discovery, the releasing of modified mosquitoes carrying the Wolbachia bacterium. Could you tell us about that eureka moment?
So I've been working on Wolbachia for many, many years. It's a intracellular bacteria that's very common in insects and harmless to people and harmless for the insects it lives in as well. But a discovery that we made a number of years ago now was that when a mosquito had certain strains of Wolbachia in its body, then viruses like dengue, but also yellow fever, Zika, chikungunya, etc., couldn't grow. They can't grow in the mosquito's body. And if the virus can't grow in the body of the mosquito, it can't be transmitted on to another person. And so the discovery that sort of underpins our work is around the observation that if mosquitoes have this naturally occurring insect bacteria in their bodies, then they can no longer transmit disease between people, or disease agents between people, I should say. We're deploying currently in around about 11 countries globally, and we've protected around 11 million people to date with the method. And this method involves just releasing mosquitoes that carry this Wolbachia bacteria, and the bacteria then spreads into the wild mosquito population and maintains itself.
Wow.
So it doesn't have to be reapplied. If you live in the tropics of the world, you'd be probably used to the continuous march of people wanting to kill mosquitoes and having to do that all the time, empty out water, fogging insecticides, all the treatments that are done, and they're all pretty ineffective as evidenced by the amount of disease. But the method we have, once we release them as the Wolbachia into the insect community or insect population, it maintains itself. It just has to be applied once, done once, applies it, stays in the population and stops disease transmission.
Oh, that's fascinating.
So it's natural, it's safe, doesn't involve use of toxins. It has to be applied only once. And it's incredibly cost effective in most areas where there's a lot of dengue transmission. Applying this method will actually save the government money because it will avert a lot of direct medical costs associated with treating dengue. And so you have a sustainable and cost-effective method.
So in principle, you're breeding good mosquitoes. I hear that Brazil is planning to build the world's biggest mosquito factory and release up to 5 billion mosquitoes each year.
Yeah, so Brazil, has a very large population, it's a very large country, and it has a very large problem with dengue and yellow fever, Zika and chikungunya. So it's a really big problem in Brazil. And Brazil has been working with us for about almost 15 years. We've done a large amount of work in Rio de Janeiro in Brazil. And the evidence now is so compelling that we're getting ready to scale up across the country of Brazil. And as part of that, we'll be building this very large mosquito factory which will supply the mosquitoes for more than 30 cities in Brazil that need treatment. And that plan is being replicated in other countries as well. Indonesia is starting to scale up the method across 6 cities, and we're working across Bali at the moment, just starting to, we hope we'll be able to eliminate dengue from Bali over the next few years, which will be great for the Indonesian economy and also the Balinese people and the tourists that go there every year.
Absolutely. A long list of countries that you've worked with. Could you share with us some of the outcome of what's been like so far? Have there been drastic drops in severe dengue cases?
Yeah, so when you're a scientist and you work on diseases, there's a way to approach measuring the impact of your intervention. And these are clinical trials which are very precise in how they're done and very expensive. And we did probably the world's largest clinical trial for the city of Yogyakarta in Central Java, and in collaboration with local scientists. And we divided this city into 24 zones. 12 zones got the Wolbachia treatment, 12 didn't. And then over a period of time, we measured a 77% reduction in dengue virus transmission, and we measured an 86% reduction in hospitalizations of people needing treatment for dengue. So those numbers are really high. But we're talking about similar levels of protection that you receive against HIV transmission by utilizing a condom during sex. So it's very high levels of protection. And I don't want to speak out of turn, but we're interested in the notion of whether we might see elimination of local dengue transmission completely in Yogyakarta. And now that's moved to across the whole province. And so we've treated about 1.5 million people there in that province. So the impact looks very large, and we're seeing similar types of impacts across the world where we're working.
Quite significant indeed. But despite the success of Wolbachia-based methods, what are some of the persistent challenges when it comes to controlling mosquito populations and preventing the spread of disease?
There are a range of problems. It's not trivial to grow large amounts of mosquitoes and release them into areas with community support, because the way we do the method, there are different groups using Wolbachia in different ways these days. And the way we use it in the World Mosquito Program, we release female mosquitoes because they contain the Wolbachia, and female mosquitoes bite people. So our methodology has us growing and releasing mosquitoes will bite people. That goes counter to all of the health education people receive. Kill mosquitoes, don't let them bite you, etc.
I see.
And so you have that approach, and then we have this new method being used which actually releases mosquitoes. And so that's intuitive for a community to understand. And so the community engagement can be quite important to be done well. And that can be particularly difficult when you're working in areas that are very poor and where there are not good government control of areas. So we work in big South American cities, which the slum areas can be very dangerous. The government really isn't in control of large sections of the cities, and run by gangs to make the possibility of working in those locations very challenging, which are where we want to target because that's where the disease is. And so learning how to work in those settings effectively is quite a challenge when you think about scaling up a method like this globally.
Hello everyone, my name is Crispina,
And I'm Adrian.
and we're the hosts of a podcast called Work It.
If you've never heard of it, well, it's a good time to tap in.
In the last 20 episodes, we've discussed topics like how to negotiate for a salary increase,
Or how to get along with younger colleagues who have different values from you, which incidentally is our top performing episode.
if work consumes your life and you want some perspective on issues like management, stress, even office romance, then this podcast should be on your list. A new episode drops every Monday.
Catch us on the CNA app or wherever you get your podcast.
Other than, as you mentioned, poverty and poor governance, based on your observations, what's wrong or what's lacking from the way many governments and authorities manage dengue and other such diseases today? I mean, in the cases of Peru, for example, the situation got so bad that the health minister had to step down. What more needs to be done, do you think?
The big problem with the disease like dengue, the natural biology of dengue disease is that usually you'll have a big outbreak here, and then you'll get 2 or 3 years where it's all quiet, and then you'll get another outbreak. It's like that in Singapore, it's like that in Jakarta, it's like that in Rio de Janeiro, all over the world. That's the natural biology of diseases that are mosquito transmitted like dengue or Zika. And so massive outbreak, big pressure on the health system, hospitals fill up, and then a lot of pressure on the government to do something. But what happens is just naturally, without doing anything, dengue then goes away the next year. And then usually the government claims success. Our method has been effective. Our public campaign to empty out water, our fogging of insecticides through the streets has been very effective. And so everybody goes back to sleep. And then 3, 4, 5, depending on where you are, years later, dengue reemerges again.
I see.
Because it's not constant year after year, the political pressure to actually solve the problem is not consistent. And as a result, it's very hard to sustain that political will from governments and the cost and the expense of treating. And so there's a number of challenges that make controlling this very, very difficult.
What other innovative approaches or technologies are being explored to tackle mosquito-borne diseases and their spread?
There are lots of other interesting approaches happening with modified mosquitoes from other groups. People are genetically engineering mosquitoes in different ways so they can't transmit, and then coupling them with gene drives to push those modifications into mosquito populations. I think that's all really interesting, but for me, we're interested in simple and natural. I don't have a problem with EM approaches, but I don't necessarily think communities are politically ready for accepting some of those technologies at the moment. Maybe in another 20 years that will be the case, but at the moment I think there's some concern about the public acceptance of some of those new technologies. And so I think the future will be interesting to see a range of new approaches. There's also ongoing vaccine development work, a number of new vaccines in the pipeline. The first dengue vaccines to come out had some troubling safety signals, and so haven't really been taken up very widely. But still there are others coming down the pipeline, which will be very interesting to see over the next 10 years or so. So while the disease problem is getting worse and worse, there's actually a very interesting pipeline of innovation and potential solutions that will hopefully be able to tackle these diseases and control them in the future.
And Scott, I understand that the World Health Organization has set ambitious goals to lower dengue incidence and reduce the dengue fatality rate to 0 by 2030. How feasible do you think this goal is, and how can global resources be better mobilized to make significant progress in dengue control?
I think clinicians are getting better and better at the management of dengue around the world, and case fatality rate has come right down. And I think that should be able to be expanded into areas that are poorer and the health system is less advanced. But really the future, I think, is not in case management. I think the future is in prevention, is in public health. And that's where we're focused. How do we stop people from getting sick in the first place rather than trying to treat them afterwards? And the big problem with these diseases is the social and economic cost of them. If you look at how many people actually die of dengue each year, it's not a huge number, but what is a bigger problem probably than that, if you look at a population level, is the drag that it creates. Socially, economic, children are not in school. In poor countries, people have to be cared for while they're sick. They can't work. Often that burden falls on women. It's like a sea anchor dragging behind the country's development trajectory. And the solution is around prevention, long term, and taking the cost burden off, taking the social cost off. That's, I think, where we really need to be focusing. It's one thing for the World Health Organization to set lofty, ambitious targets or put a strategy paper together that will reduce dengue by 25% over the next 3 years or something. I think ultimately it's going to be the governments of countries that are afflicted by these diseases that need to step up and do something about it. Seems like a bit of a no-brainer, if you like, that we can think about our future where dengue is much less of a problem. But it requires a concerted effort, and I think that effort should be focused on prevention more than treatment.
All right, that's a message of hope and action. Well, thank you very much, Scott, for providing insight into the world of mosquitoes and dengue. Thank you for your time.
Lovely to talk to you, Julie, and thanks for your interest and work.
And thanks to all of you for tuning in. We hope you enjoyed this episode. Now, do remember to subscribe and like this podcast so you know when a new episode drops. That you can find CNA's climate and sustainability coverage online at cna.asia. The team behind this podcast is Tiffany Ang, Jacqueline Chan, Sein Win, Crispina Robert, and me, Julie Yu, signing off.